October is Dysautonomia Awareness Month, and there's no better time than right now for me to tell you all about it. Studies in August have shown links between COVID-19 and dysautonomia. There are at least 15 different types of dysautonomia, and the most common are neurocardiogenic syncope and postural orthostatic tachycardia syndrome, or POTS. So many people are having lasting effects from COVID-19, and nobody can make sense of it. Some people report that long after recovering from the virus, they have some weird substance leaking from the palm of their hands, while others remain bedbound long after their recoveries. And even others can hardly walk 3 feet in front of them without having to lie down so that they don't faint. Many of those who have recovered from the virus have lasting heart problems, organ problems, even things like sweating is something that they find that they can't do anymore, or even vein and muscle and joint problems, even problems just moving their body around. This is because of the effects of COVID-19 hurting the nervous system. The education about dysautonomia is so important right now because of what I went through with it and every other person has gone through with it, and because of all the people now getting it in some form. Because it's an unknown condition, there's only a handful of doctors that will take them seriously and know how to help them because they haven't heard of it. Doctors are not trained to know what to do with it. Your nervous system is made up of 3 parts: the central nervous system, the parasympathetic nervous system, and the sympathetic nervous system. Depending on your symptoms, you can tell which part of the nervous system is affected. You can learn more about this at dysautonomiainternational.org. It took me 4 to 6 years just to be able to walk again because I was bedbound. I started getting sick back in 2007 with stomach problems that lasted years, as if I had gotten some sort of virus. And what came after that was lifelong heart problems, fainting issues, orthostatic hypotension, seizures, gastroparesis, motor skill issues, and probably 200 other symptoms, including liver problems and gallbladder problems, and sweating problems, and problems with eye dilation, even swallowing problems. When I say 200 other symptoms, I'm not even exaggerating. Some symptoms are so odd and strange that no one will believe you. I used to wake up every morning with blue lips, unable to breathe. I developed Raynaud's syndrome and SVT and heart arrhythmias. They gave me 2 ischemic heart attacks. And now I have to wear a gas mask almost everywhere I go because smells and scents and chemicals cause anaphylaxis, as does most food now. Even though all tests confirm that I'm not actually allergic to anything, but my body is now allergic to itself. Now more than ever, there needs to be a lot of education on this, and I don't mean Google. Looking up the different dysautonomias on Google only scratches the surface. When I keep seeing studies coming out showing all the people ending up with some kind of autonomic dysfunction and dysautonomia from having COVID-19 and recovering from it, I knew I needed to reach out. The thing is I don't even know how to reach out to doctors and medical people because the most of what they can learn is through learning from us, the patient. And the reason that is because we're really the only experts so far on these conditions, since all or the majority of doctors don't have any clue on how to deal with it. I've never been trained for it. Autonomic dysfunction and dysautonomia affects every area that you could ever think of in the whole body and the mind. When I was diagnosed with POTS, they thought that I was crazy and making it up for years because giving me a saline infusion made my symptoms go away, so they thought it was just anxiety for many, many years. After my diagnosis, I found out that saline infusions is a treatment for POTS symptoms, which would explain why some of the symptoms went away. But at the time, I wasn't diagnosed, so I didn't know how to treat my body. Now, I'm hearing that people that recover from COVID mostly end up with POTS. Not everybody, but a lot of them. POTS, again, stands for postural orthostatic tachycardia syndrome. When people with POTS are upright, sitting up or standing up, all the blood in our body pools to our legs and doesn't come back up on its own because our arteries in our legs don't constrict the way they're supposed to pump blood back up into our heart and our brain where we need it the most. As a result, we end up with a rapid heart rate and fainting problems, among hundreds of other symptoms throughout our entire bodies. It's really no wonder that doctors don't want to touch us because we have one thing that's affecting everything in our body at once, and we are probably every doctor's worst nightmare. I personally was found to have sympathetic nervous system dysfunction, which affected things like sweating and my fight and flight response, and made me have severe anxiety around the clock constantly that never went away, even if I personally wasn't really having anxiety, just my brain was. If I saw anything that scared me even slightly, like someone came up behind me and said boo, it would send my fight and flight response over the edge to the point where it would cause something called adrenal dumping, which is terrifying because epinephrine pumps through your body when it's not supposed to and causes your heart to race and sometimes can cause shock. I also used to get adrenal dumps every time that I had an SVT attack, which is normal in most people with SVT. But because of my sympathetic nervous system in overdrive, it affected me a lot more and made my troponin levels go up, which are indicators of heart attack or cardiac arrest. I would not wish this illness on anybody in the whole world. I used to do nursing, and I used to be a singer and an actress. I used to have a lot of friends. I dated, I played a lot of tennis, swam in the ocean, climbed trees, kayaked, traveled, went on nature trails. That person is gone. Next thing you know, I'm bedbound for years and unable to dress myself, unable to sit up for more than 2 minutes at a time. I almost didn't survive. Literally. It was waking up every morning to be tortured daily by something that no doctor wanted to help with or fix because they didn't know how. And the only reason I'm able to stand here today and talk is because I had gotten 2 ablations done on my heart and have been in therapy for PTSD for a number of years. I still have symptoms constantly, but I'm managing the best I know how to without really any doctor's help. I don't know what tomorrow is going to be like, and I don't know what my future is going to be like at all, but I'm going to use this moment to discuss this with you all because it is so important right now. The more we can spread this education about it, the more people recovering from COVID-19 that develop it will get proper help. This might be the only way that I can reach out. And I don't know how many views this video will get, if any at all. But I'm ready and willing to help educate anyone in the medical field that wants to know. I have done a lot of studying over a 12-year period and how this affects the body and what to do and what not to do because I live with it daily and I've seen the worst of it. I'm not a doctor and I don't pretend to be. Doctors are amazing at what they do, and so are nurses. All I want to do is help them with this because it's gonna get rough out there. This used to be unheard of because it was more rare. It's not rare anymore. It's not about to be rare anymore. because I have a feeling that this isn't going, it's just not going to be rare anymore. Now that so many of us have had COVID-19 and beat it and are left with it, this needs to get out there. Thank you to all the medical personnel out there, wherever you are and whoever you are. You're amazing, and I see you, and I notice you, and thank you for watching this. This fight might not be over yet, so let's do this.